Hey everyone, welcome to PH 532. This is my introduction. Also, I talk a little bit about what I expect from you in the class and also what you can expect from me. All right, so a little bit about me. I grew up in San Diego, actually specifically in Mira Mesa. I went to Scripps Ranch High School. I always thought that I would stay around here and not really travel too much. When I was applying for schools, I, had this inkling. I'm like, let me just apply to a couple of good schools and see what happens. So I was actually really pleasantly surprised to get into UCLA. I wasn't a bad student or anything. I was a pretty good student, but there are times when look at averages and qualifications, and sometimes you're like, well, I don't know if I could really get in or do that thing. But I took a chance, and this is where I started to kind of develop this, just do it attitude. And I tell this story to help inspire that same attitude as well. So anyhow, I was really surprised, but really happy to get into UCLA. I started off as pre-med, but really quickly learned that my idea around health was I was really interested in how to, prevent disease or develop programs, for teens or around sexual health. So I really had this public health mentality without knowing it was public health at the time. There were very few public health programs. Now public health is booming, as you know. But at that time, I wasn't sure where I wanted to head, but I knew that that was the framework in which I thought about health, more on the prevention side. So anyhow, that led me to public health. I minored in Spanish literature, studied abroad in Mexico, really wanted to learn Spanish. So that was my undergraduate career. So taking that same lesson of, shoot higher than maybe you think, or, just really aim high, have a just do it, kind of Nike attitude. I kind of did the same thing. And by this time I knew public health was likely my trajectory. So I applied to some programs. And again, I applied to some pretty good programs with no, expectation. But I was really humbled and really happy to complete my Master's of Public Health at Yale University in chronic disease epi. And at that time, it was a concentration. I think it's separate now. But I did my concentration in social and behavioral sciences. And I was also able to complete my MPH master's internship at the CDC. So it was a really great experience. Moving from California to Connecticut, I'll tell you that the first time it snowed, I put on my snowboarding outfit and I thought I had frostbite. So everybody knew that I was from California. So anyhow, I adjusted pretty well. But it was definitely nice to experience seasons. Fall, winter, spring were not just academic seasons anymore. They actually had meaning to them. In fall, the leaves fall. Winter, it's cold and snowy. And summer was really hot. Spring. So anyhow, that was my journey to the East Coast from California. I'm glad I got to experience that. But then again, I thought I would come back to San Diego, but then I just continued in that same mentality of like, you know what, let me just apply to a few good programs and see if I get in. I was really lucky to get into the #2 School of Public Health. #1, if you're just looking at public institutions, which was UNC Chapel Hill. The concentration was in health education, health behavior. And anyhow, that's where I got my PhD. So again, kind of that same attitude, just keep doing, keep applying, you never know. And again, I tell this story because I feel like a lot of students, or just anyone in general, might look at a job or some other thing that they wish they could do or obtain and kind of think like, well, maybe I don't have what it takes, or I'm not good enough, or I don't have the high GPA or that average or this skill. And I would just encourage you to just go for it. If it costs, an extra, couple dollars, not couple, like in my case, applying $40 to send an extra application and you have that, if that's what it costs just to see, go for it. If it's, filling out an extra application or talking to someone else, I've developed that kind of just go for it, just do it Nike attitude. So I tell this story just to make sure and inspire anyone who might feel the same way whether it's about school, a job, or anything. Hopefully this little story helps, hopefully change a mind frame that, you can do it. Just go ahead and try. So anyhow, that's about me. Another reason I kind of go through my background is if there's anything that I've done that you're interested in, or a particular school or a subject matter, I want to put it out there so you know what to ask me about, or I can help and guide. I love talking about, career trajectories, big life decisions. I've had transitions, through all these, educational experiences and having to decide, do I do, work-life balance, or do I spend time doing a thesis on this? Do I have other opportunities? Do I use an opportunity that's already at hand? So anyhow, I have some of that experience, and if you ever want to chat about the decisions you're trying to make, feel free to reach out to me. I'm always glad to help. So that's about me. So once I finished my PhD, I finally had the opportunity to come back to San Diego. This is another lesson in keeping contact and building good networks. Every year that I was away from San Diego, I would check in with my mentors who happened to be at the Institute for Behavioral and Community Health at San Diego State University, and would say, hey, I'm in an MPH program now. Hey, I'm in a PhD program. And lastly, hey, I've graduated. Do you have a job for me? So keeping a good network of mentors and people that you work with, really did help as far as, for me personally, coming back to San Diego. And what I was able to do was become a project manager when I was done with my PhD for Project Goal, which is Guide to Obesity Prevention in Latin America and in the U.S. It was a large systematic literature review by CDC, funded by CDC. So even though it seems like a literature review, it was actually quite a bit of work. It took almost 4 years to complete. And that was based on gathering evidence to make recommendations for obesity prevention and treatment in the U.S. and in Latin America, different Latin American countries. So it was a huge systematic review. But then I was also the coordinator and lead for evaluation for a randomized control trial at SDSU called Fe en Acción with Dr. Elva Arredondo, and Project Goal was with Dr. John Elder. And that was an RCT, so there were 8 churches that received an intervention, which was physical activity, and another 8 churches that received a cancer prevention workshop, and I helped to coordinate a lot of the evaluation efforts. I would say whether you're done with your master's program or you decide to go to PhD, being a project manager and a coordinator after school was one of the best positions that I've had, because I was able to get exposure to, coordinating studies, designing, coming up with the material, even down to budgets and staffing. All of that I feel has made me a better principal investigator or lead person, because I know how everything works. So a project management or project coordinator position, especially if you're interested in research, is a great position to have straight out if that's something that you're interested in. I feel like it helps me in my current research and work, having had my hands on everything beforehand. Here are a few pictures. I do like to do a lot of field work, but in this systematic literature review project, the only thing that we could do field work wise was go to a coffee shop. So that's where we are here, conducting a lot of the reviews. And then for Fe en Acción, here's a picture of us out evaluating a church and the physical activity or potential environment surrounding the church. But of course, as I go through my career, I try to think about, what is my niche? What is my research focus going to be? And I've always had an interest in both Latino health and Pacific Islander health. And so one of the first grants that I put in was to American Cancer Society, and this was the start of my Pacific Islander Community Health projects, or PIC Health. And so this is where I first started in this trajectory. Overall, my interests are in health disparities and working with a community-based participatory approach with communities hand in hand together to figure out what are the types of programs, health concerns, interests that they have, so that together in an academic community partnership, we can figure out how to design and implement a program. So this study, again, in order to do that, we put together a community advisory board to help, give us especially with PIC Health, to understand culture, to create a network of contacts, and to really help guide the work and eventually the research. Here are a couple pictures of some of my students. Some of them at a research symposium are giving their thesis talk, and some just having fun. So the initial work really led to, I actually got lucky that it led to an area of research that I was already familiar with, if you think back to when I first got back to San Diego, which was around obesity, diabetes, physical activity and healthy eating. So those are the things that we identified as interest to the Pacific Islander community in San Diego, and that helped develop this next pilot study. So I worked with a community partner, was a native-owned gym or fitness center called Ramana Fitness. We trained community health navigators to lead physical activity classes. We, took height, weight, waist circumference, and of course, every researcher has a ton of survey questions. In this context, physical activity, nutrition, other health behaviors. And we measured in the beginning of the program 12 weeks and 24 weeks. What's great about working with a community partner, and especially a gym, is that they had a lot of their own equipment. So here you can see this gym has its own hydrostatic dunk tank so that we can get percent body fat. And this is actually a picture of the owner training some of the students and interns on how to weigh someone in the hydrostatic dunk tank. Here are a couple other pictures from our pilot study, excuse me, just to kind of show also how fun it is to get this work going in the Pacific Islander community. Another opportunity I had, I won an innovation. It was kind of like Shark Tank. So innovation contest. I had an idea from the public health perspective. How do we get out some of these mental health tools beforehand? So anyhow, in short, I have a planner, and it's a physical planner, and it's based in cognitive behavioral therapy, CBT. It has a lot of tools, and the idea was, we have individual counseling. So if someone's experiencing or living with depression and anxiety, you go to counseling, and individually you'll get a tool, and say, oh, try, this self care tool, or try this thought record, or try, a number of CBT tools. But coming from a public health perspective, I was really interested in, well, how can we get these tools out sooner? Or maybe to people who are not, seeking individual care yet. And so that's how I came up with the planner idea. And anyhow, this was just another offshoot of an interest that I had. But it was really interesting because it kind of combines business and public health, which I've never done before, and had to really, again, become a student myself in that area. But anyhow, if you're interested in mental health, feel free to look up this site, cogtools.com, and then you'll see how this project unfolded. It's still going on today, but my large focus is on my research around health disparities. But this is another interest of mine. Okay, so what do I expect from you? I expect that you will interact and engage in the class. Probably even more important, an online class, since we don't get to speak and engage face-to-face. We'll do that through online discussions, and I've created some chat rooms where I want to see you discussing with your group members. We do have some group assignments. At the very least, how to get started, introduce yourselves, get to know the group, and I'll use the chat rooms too for the groups to chime in and give you some direction that might be specific to your group. But anyhow, so I do expect a lot of interaction and engagement. And this is the first time we are offering this course online. So if for some reason you feel like you need more opportunities to interact or engage, please feel free to reach out and let me know, and could always figure out other ways. Of course, be mindful of your conversation, and similar to the last bullet, professional and always respectful of others' opinions and thoughts. Ask a lot of questions, but I also want to create an environment where everyone helps each other out. So if someone's asking a question and you get to it before I do, or you know the answer, if it's about an assignment or a due date, I just wanted to create the environment where everyone is not out for your own success and just ramming through the course, but also helping each other out, which is why we do have some group work as well. But again, trying to create a kind of an open and comfortable environment. I do that, in person, but I also want to create that environment online as well. I do really want to try and replicate the active learning environment that I do in person. I'm approachable. I listen, but I also want you to take charge of your own learning. So before you ask a question, make sure you've read the syllabus, make sure you've gone through the chapters, you've asked classmates, you've even done some Googling if it's about a particular topic. I really encourage you to take charge of your own learning and develop those habits now as you go through this program. Oh, it says ditto here because usually you take this course along with 504, but you won't take that until the next 8 weeks. But anyhow, you will have most likely that class with Dr. Deborah Morton, and she talks a lot about the growth mindset, so I usually just say ditto on that one. But also keep that in mind as you go through this course and certainly through the program. Now, one of the things about learning and actually retaining the information is that you do learn more when you teach others, when you practice by doing, when you're actively involved in discussion. It's a lot harder to learn when you are listening to a lecture, reading, audiovisual and some demonstration. But really, to be active, you have to be doing something or have some kind of hands-on experience. Is not this to say that we won't have lectures or reading, because we do, but the way that I try to at least incorporate the information or have some of the activities is I will try to find ways to make it more active or as active as possible. Sometimes, whether it's the type of subject matter or the timeliness, sometimes you just have to get the information out and lecture. So you'll probably have some PowerPoint slides where I'm going through the material. Some warrant a lot of explanation and some don't. So it just kind of depends, but I'll say as far as what you can expect from me and this course, I will do my best to try to make our discussion and some of the activities that you do as active as possible. So again, feel free to give me any feedback. If there's something that you would like to see or something that you like, let me know. That's about me and what you can expect. Now use the discussion board and tell me about yourself. Looking forward to getting to know you.